step. If you are not stretching, as you cannot come back to the field. You cannot come back to the championship. Okay. Yeah, step 1, step 2, you have to do like that. Next, periodic rehabilitation treatment is 20 week to 30 week. Step 3, strength and neuromuscular control, 20 weeks to 24 weeks. Number 1, increase the muscle power. Number 2, increase the endurance, muscle endurance. Number 3, improve neuromuscular control ability. Number 4, a functional activity. Okay. Okay. After explain, I gonna show you the exercise. Okay. Okay. Step 4. Return to the field. 24 weeks to 30 weeks. You have to check every day your body. Your ankle, your back, your knee, okay? So number 1, complete pain removal, complete activity, okay? Do not remember. If you keep the pain, if you have keep pains, do not exercise, please. And then complete activity. Before injury, when you side kick, when you round kick, when you jump around the kick, you can complete activity. You can return to the field. Okay, everyone. Don't forget, or is return to the field. If you complete pain removal, complete activity. Okay. Next, see, I wanna make number 5, but a lot of the Taekwondo players, karate players, and Pumse players have a play fit because we are everyday training. Okay. After training, you need to, and then you must do training. How to do? Okay, I'm gonna show you after. Okay, so see, you have to check your feet. Now, please, number feet is like this. It's round like this. But if you have flat feet, is you are very pain to here. Right? Can you see? Because the nervous, your muscle, nervous, your muscle, and ligament, your tendon, your gone. Okay. And you can use the tennis ball on the round ball, any small ball. You can use the exercise, and then you have the therapy. You have to therapy your fit therapy. Okay. I'm gonna show you after. And then you can check the behind your posture. See, this blue line is a has to put posture is like this. but flat foot posture is a little bit pronations like that. Okay, if you have a problem your neck, if you have a problem your back, if you have a problem your pelvic, your knee, is make your flat foot posture. Okay, and then everybody check please each other. Okay, pronations is natural, is like there's a line. Yeah, this line is like okay, like this. Okay, if you pronation is the you are have a flat foot. Okay, as a supinations is you are exversion is be careful your eversion your ligament and your gone your tendon. Okay. Next. 통역사님 계실까요?
네, 잠시만요. 네, 말씀하시면 됩니다.
네, 여기 understand 여기서부터요. 여기까지 한 번만 좀 읽어주세요. 제가 발음이 좀 부족해서.
제가 읽으면 될까요?
네.
화면 보이는 대로 읽으면 되겠습니까?
네.
Healthy foot posture, and on the right it says flat foot posture.
지금 여기 화면 보이세요?
지금 현재 PPT 화면밖에 보이지 않습니다.
여기 understanding motor impairment 안 보이세요?
네, 그 페이지
네.
보이지 않습니다.
그래요?
네, 이제 보입니다.
네.
First of all, sorry about the confusion. I'll read it through. It says understanding motor impairment, the types, mechanisms of movement injuries. First, the damage is small but requires long-term treatment. Very closely related to lifestyle, which includes walking habits, jogging, climbing stairs, etc. Finally, it is easier to secure stability than any other joints. There's the ligament injury, the most common sports injuries. It is distinguished between chronic injury and acute injury of the lateral ligament, very closely related to ankle instability. And there's the anterior neck called ligament injury. The ligament that connects the anterior and lateral radiography of the clavicle vertebrae. When going downstairs, wear high heels, the injury mechanism is in the state of plantar flexion, backing and inward smearing because they happen at the same time. Okay, the next will be soleus muscle sprain, soleus muscle, calf muscle, shin pain, Achilles tendonitis, calf tendon impingement syndrome, the muscle that causes plantar flexion located deep in the calf muscle. Contraction and relaxation of this muscle is very important. If you do not do regular stretching or strengthening exercises, damage may occur. When the calf muscles feel fatigue, sprains easily occur. And there's a chronic instability ankle, loose due to chronic damage to the ligaments, repetitive sprains, which equals sprains, as it can cause ligament rupture and cervical cartilage damage. Appropriate rehabilitation exercises are required.
감사합니다.
Thank you very much.
Everybody understand? You need to understand, please. Every coach, every taekwondo athlete, please. Okay, next is the fatigue fractures. Fatigue fracture is tired, tired fracture. The same. Okay. Okay, if you are X-ray, if you have this is one is X-ray. Your tibia and fibula. This one is very white, very white. Normally is blue or white blue like this one, but if you tire and fatigue fractures is white, make a white. Can you see? So if you cannot X-ray, take an X-ray, you can test the this test. How to do? Okay. Further down, at least, and then here, how to do? Here you have to use the two hands, and then you have to push at 3 seconds. 1, 2, 3, and rest. One more. Use the two hands and push. 1, 2, 3 seconds. It's 3 times. And when you push, if you have a pain, you have fracture. You have fatigue fractures. You are tired, and then you need to rest. Okay. Test this Thompson test. Next, bump test is pressure test. Half sit, and then left hand you have to hold your ankle. Then right hand is the heel. You have to heel the push hit a little bit, hit your little bit, hit the heel 5 times. 1, 2, 3, 4, 5 times. If you have pain, yeah, the fracture, fatigue fracture like this, very tired your leg, you need to training. You need to rest. Okay. Yeah. Next, a squeeze test. Yeah, same. Use the two hands. Your two hands, and then sit. Yeah, push the calf, tibia. Understand? Tibia. You have to use the two hands and push the tibia as 3 seconds is 3 times. Okay. Check the pain. Check the pain and fatigue fractures. Next. Okay, we are on to your ankle rehabilitation treatment, and then how to do test, and then how to do exercise. Yeah, right now, as we are launched the exercise. When we start the exercise, we need to remember this one, FIT, fit training. Okay, is see F first, the frequency. 1 week, how many times? Okay, we can fix the offense. Okay, how often do you usually 1 week, how many times? Okay, frequency is very important. If you rehabilitation treatment every day, low every day, low intensity. C, I intensity. T is type, ST is time. Frequency, intensity, type, and time. When you start the rehabilitation treatment, 1 week is every day. 1 week is 5 times, right? And then intensity is the low intensity. How to do when you weight training is a low intensity is 10 times to 12 times. Okay, like that. As type is the swim or weight training or stretching, yoga, is like that. Okay, is time is the if you surgery after is very tired your body, right? Then so if you are a long time to training, it's very tired, and then it's not treatment. Okay, and then I think we are start the rehabilitation training is 30 minutes to 14 minutes, very good for you are treatment training times. Okay, don't forget frequency and intensity is time. And, if you are little more is good conditions and make a good muscle, make a good stretching and stability and mobility, you increase your frequency, intensity, and time. So from 30 minutes to 40 minutes. If you after 2 weeks, you have to 5 minutes to 15 minutes. So like that, you have to increase the FITT exercise. Okay. Okay, next rehabilitation treatment, how to do. If you surgery your ankle, so tear your ligament, is very good for this training. First, you are stretching. How to do? Use the towel. Grip the side and hold your feet. Okay, little bit push like that. Little pull like that. And when you stretching, be very important. First, 10 seconds. 3 seconds to 10 seconds, and then after 2 weeks you have to increase, right? 10 seconds to 50 seconds. Okay, if you are good stretching and if you are good mobility, you are increased again. The maximum is 30 seconds. It's very good for your stability, your ankle mobility. Next, your toes. You have to help the coach and help the another player and friends and family. Like that is your toes. Push. You have to when you coach the push your toes, you have to the pull. Oh, sorry about that. When you coach your toe, push your toe, you have to push your toe. You have to push too. Okay, right. Okay, this is a neuromuscular, and then your muscle and your balance training is very good. Next, you can, and then everyone use the saraband. Okay, have the coach or by yourself, and then up and down and right and left. You need to training as 4 directions. Okay, up, down, right, left, like this. Yeah, I told you 3 seconds to 10 seconds. You have to start the stretching. If you good mobility, increase down second. Then next. If you are finished the stretching, and then stretching, you need to the weight bearing. Weight bearing is like this. Do not heavy. Do not use the weight stuff like this. You will stop your feet, your heel out, and stretching, and then your weighting bearing training like that. Use the step ups or stair. Okay, last, use the towel. Okay, use a towel and then pull the towel. Use your toes. Next, use your toes and marble or a little bit very small ball. Pick up the ball and the movement. Is very good for your ankle treatment training. Next, neuromuscular balance training is very good. So like this, air ball is you stay here, and then very good for your neuromuscular and balance training. Okay, thank you. All set, everyone. Sorry. Okay. Now I'm gonna show you the rehabilitation training. Okay. The first, did you check your flat feet, everyone? Okay, I have a flat feet. Okay, so I told you if you have a flat feet, you can use the tennis ball and the small ball like this one. Okay, it's not a soft, a little bit hard. Okay, like a tennis ball is very good for you. Okay, see that this one. Sit down on the mat, and then your ligament is here, and your feet is in the center. You have to rolling your feet like this. if you're very tired, people is if you very pain, you are feeling very pain, but you need to do, you have to do, okay? Okay. Right leg is 20 times. It's like lowering like this. Then left leg, same, like this. This one is very good for your feet, flat, your flat feet. Okay. Next, is a training. Use the towel and servant like this one. Okay. See. Have still again. Have still again. And hold your legs and tie. Now when you start the first time, do not tie. Okay. Loose like this, and then when I for the servant, you have the true direction, your down directions like that. 1, 2, 4, 5, like this. And if you are training by yourself, you can use any stuff. Okay, I have a chair. And then grip. Okay, we tie the servant. Like this, and then everybody see that? Okay, like this. Okay, hold the chair and my feet like this, and that. Correct directions. 10 times to 20 times, like this. Okay, outside same. And outside same, like that. Okay, outside same. Like this. Okay, I told you, if you are easy to this training, you are all tight your servant. Okay, you can choose your exercise intensity, everyone. Okay. Next, okay, hold the real ankle. And first time you cannot balance is you cannot imbalance, and then you have to hold the euro next, and then like this inside and behind and front and outside, like this. You have to training like this, everyone, okay? And then if you by yourself use the another style, then You can use the two legs like this. Okay, same other leg. A little, you can roll tight, roll short, make a short experiment like this. It's very good neural muscle and neuromuscular training, everyone. Okay. And next, I told you. Okay, everyone take off your socks and then use your towel, use your toe, and pull like this. See? It's very hard if you're surgery people. It's like that. Keep going. Okay? If you don't have an L board, you can use this one. See? Standing on the center, you stare back up and stay. You have to stay is a maximum 1 minute like this. If you easy to is training, you training stuff like this. Like this. Okay. It's an imbalance floor. Imbalance floor is very good for your neuromuscular and your balance training. Everyone, okay? Okay, everyone have this class. Have your training. Okay, next time I prepare to more good informations and more good training. I prepare to. Okay, everybody, good jobs. Do not don't forget price technical. PRICE protection is rest and icing and the compression is elevation. Don't forget. And next, when we start the training, FITT. Okay, frequency. Okay, and the intensity and type and time is very important. Okay. Everyone did a good job. I'm gonna class is finished. Everyone, thank you for attention and see you. Bye.
Thank you.
Okay. So.